There are myths about home birth that even doctors still believe. And I don't say that lightly. I say that because most OBs were never trained in physiological birth. They were trained in emergency surgery and managing risk, not trust, not instinct, not normal birth. So when you ask them about home birth, of course they're going to say it's dangerous. Of course they'll say it's risky. That's not science talking, that's conditioning. One birth is too risky compared to hospitals. Let's start with the biggest one. Home birth is risky. Sounds official, right? But what's it based on? In reality, multiple studies, including from countries like the UK, Netherlands, and Canada, show that for low-risk pregnancies, home birth with a trained midwife is just as safe as a hospital birth, sometimes safer. Why? Because when birth is left alone, in the right conditions, it works. When a woman feels safe, private, and supported, her body doesn't fight labor, it flows with it. And guess what disrupts that? Fluorescent lights, rotating shift staff, vaginal checks from strangers, beeping monitors. Your body doesn't know you're in a hospital, it thinks you're in danger. My birth is only for hippies. Another myth that home birth is some fringe idea, a rebel thing, something for crunchy moms who make their own kombucha and reject all medicine. Nope. Home birth used to be the norm. It's still the norm in many parts of the world. And the people choosing it today aren't reckless. They're deeply informed. They're not anti-science. They're asking for the science that supports them. And let's be honest, choosing a hospital birth because that's what everyone does is not science either. That's social pressure. That's culture. That's fear packaged as safety. Mic 3, midwives aren't real medical professionals. Here's one that even doctors repeat, that midwives aren't real providers, but certified professional midwives train for years. They're licensed, they carry equipment, they monitor fetal heart tones, they know what's normal and what's not. They're not guessing, they're experts in birth, just like an OB is an expert in surgery. The truth is, a great midwife has seen more normal births than most OBs ever will. And in birth, that matters because a midwife's first instinct isn't intervene, it's trust. Mindful hospitals are always safer because of access to emergencies. Another common one, hospitals are safer because they have operating rooms. Yes, they have them, but most complications don't happen suddenly. A trained midwife can spot the early signs and transfer before it becomes an emergency. And transfers are rare, about 10% to 15%, most of them non-urgent. That's not failure, that's good care. And let's be real, being in a hospital doesn't guarantee safety. Hospitals introduce their own risks, unnecessary interventions, infections, and birth trauma. Being near a scalpel isn't the same thing as being safe. Myth 5, birth needs to be managed to be safe. This one runs deep, that birth is dangerous unless someone is actively managing it, but that's backwards. Most complications in modern birth aren't from the body failing, they're from the system interfering. Pitocin leading to fetal distress, epidurals slowing labor, continuous monitoring forcing you to lie still. One intervention leads to another. Not safer, that's a cascade. Home birth isn't about avoiding help. It's about letting your body lead and having expert support standing by when needed, quietly, respectfully. Here's the truth. Birth doesn't need to be saved. It needs to be respected. And too many women are being robbed of the chance to find out what they're really capable of, not because their bodies failed, but because someone convinced them they would. You don't need to be afraid of birth. You need to be afraid of a system that profits from fear. Home birth isn't reckless, it's informed, it's intentional, and if anyone tells you otherwise, even a doctor, you have permission to ask, where did you learn that? Because the body knows. And when we remember that, birth gets to be powerful again.